Hi, good morning, Dr. Le. My name is Sarah Chen. I'm one of the faculty here at the residency program. It's a pleasure having you here today, interview with us. How are you doing today?
I'm doing well. Good morning. Sorry, good afternoon, Dr. Jin. And it's so my pleasure to see you today. And I'm really thankful that invited me today.
Excellent. So where are you Zooming from? Are you local or are you a little bit away? Uh,
Sorry, can you repeat again? I have problem with.
okay. So where are you Zooming from right now?
Oh yeah, so I'm from in New York. So
Okay.
yeah, so I'm in Brooklyn right now, and I just moved to New York 4 years ago.
Excellent. How's the weather in New York? Not too bad?
I think that yeah, it's not too bad. The weather is so cold outside, and the temperature I think that is about 45. But I used to this weather because that I mean that it's not bad for me. But I hope
Excellent.
that I think that it's a lot of windy outside, and I hope that the connection it will going well. So it doesn't. I hope that it doesn't have problem with our connection.
Yeah, and at any point if you start having issues like hearing us, just let hearing me, just let me know. So we can making sure that you both of us can communicate and understand each other.
Yeah,
But yeah, it's the drawback of virtual interview, right? Because sometimes you are dependent on the internet connections a little bit. But yeah, I'm really excited to have you here. I must say that I got a chance to review your application. It's quite impressive. I really love your personal statement. So, and I just want to say congratulations on all of the achievement that you achieved so far.
yeah.
So yeah, so I know that you mentioned a lot of excellent achievement there, but I want to kind of hear a little bit from you. What do you think is the most important thing I need to know about you?
Yeah, so I'm really proud of to introduce myself. So my name is Thị Bích Thoale. You can just call me Kala Thoale, and I'm from Kala Vietnam. And it's my Kala brother's inspiration that led me to Kala pursue a career medicine. So the journey took me from Vietnam to Malaysia and then to the US, and that has brought me a lot of invaluable clinical experience. And I love so much the US healthcare system, in which is why I'm here to build my career. And I also love your program. And I would love to be your team. And I'm so excited to start in your residency program.
Excellent. Wow. Yeah, so you mentioned being like you educated and practiced in Vietnam and then did some training in Malaysia and now in the United States as well. So
Yeah.
that's quite an interesting journey. So tell me a little bit more about that.
Yeah. So I graduated in University of Medicine and Pharmacy in Ho Chi Minh City. And then after that, I got the Master of Internal Medicine in University of Phang Một Tháp. And then after that, I moved to, I have a journey to Malaysia to do a fellowship of cardiovascular disease. And then after that, I moved to the US. So this is my journey.
Okay. So tell me a little bit more about the experience in Malaysia. So what exactly were that you did there, and then what was the training look like in Malaysia?
Yeah, so I think that I really love this training because it's like I remember that I attended the lecture in the morning and then in the afternoon. So I got participated in got a lab training as well as some got procedure. So they teach me about various about the medical condition and as well as research and how I can interpret the the research paper to the experiences. So I mean that, and I also encounter with some various medical conditions. So if I look back, I really it's thankful for that time. I really love that time too much.
Excellent. All righty. And I saw that you also practice in Vietnam. I think you did internal medicine residency in Vietnam and then
Yeah.
a little bit extra training there as well. So I'm not that familiar with the medical training system in Vietnam. So can you walk me through that a little bit and then tell me what was the experience that you had, that what was the training that you received?
Sure. Yeah, so I think that the training in our Vietnam is a little bit different in the US. So after we graduated, so we have three choices. So we can continue to do internal medicine. We go to the internist, or we can we can go to jump to the hospital, like to practice in the hospital to get a medical license. Or we can go to the other ways, like it's been the special slide about the clinical experience to get they call that Chinko 1, Chinko 2, yes, like that. But those courses is specialized about clinical experience. So in my way, so I got the internet. I keep studying about internal medicine.
Okay. So is that similar to the US? Is 3 years, or how long was the training in Vietnam for internal medicine residency?
Yeah, so it's almost like 2 to 3 years. So I mean, a 2 year and a half. So I start in 2015 and I graduated in 2019. I got a degree in April 2019. Yeah, so it's a
Oh,
little bit similar in here. Yeah, and I got a various clinical experience, and I think that it will allow me to easily transition to your internal medicine.
excellent. All righty. So among those experience, what was the most meaningful experience for you?
Yeah. So I think that like up to now, there are a lot of kind of meaningful kind of clinical experience and moments for me. So, but I would tell you that one moment that I love most when I did rotation in cardiology with Dr. Nguyen in Indiana. So it has been over 1 year since we got together, collaborating a major project about cardiology. And then this is a major project about cardiology. You know that because it's the research project focused on how to discover the origins of the atherosclerosis blast, and that's gonna move beyond the understand of the textbooks, and that's gonna of the causes of that gonna trigger the intimate damage of the coronary artery vessel. So additionally, I did some I served some role as a reviewer for several journals, and additionally I did some extensive in patient and outpatient in hospital and clinics within treatment, and where I can encounter various medical conditions. So through the experiences, so I learned a lot about medical conditions, EMR system, and the US healthcare system. And I learned about how to apply evidence-based medicine into clinical practice.
Great. So
Yeah.
it sounds like you got a lot of experience in internal medicine, and sound like a lot of cardiology as well in the United States. So that is wonderful. So just out of curiosity, so you were a well-established, well-trained physician in Vietnam. What was the motivation behind the decision of moving to the United States and kind of have to restart it a little bit here with the residency again?
Yeah, so thank you so much for your question. So this is really interesting question, do you know? So after I got a master degree in internal medicine in Vietnam, and I have motivated to to urge my career and do training the residency training in the US, because that I'm really interested in training residency in the US. There are four reasons I think that that make me the urge to the US. So first, I got to see a lot of patient care in the US, so have received the evidence-based medicine in that treatment. So during my collaboration in cardiology, I got to see how fascinated about how clinical decision and can based on like were guided by research. And then the patient will get the most current standard of care. So second, the U.S. clinics and U.S. hospital has EMR system and to follow up and manage the patients. And then I feel that it's really helpful to get the patient information and provide care faster. So no one needs to go around the paper track like my home country. And third, I think that like the medical care in the US is very patient centered. And I, for example, I think that like every risk and benefit of certain medication, like ACE inhibitor or sometimes that like opioid something. So, and care plan have to discuss with the patient who very involved in the clinical decision making. And fourth, I think that like palliative care, hospice, and preventive care are very units and very organized in the U.S. So, and in the U.S., so there are some evidence-based guidelines, like for example, hypertension guideline, diabetes guideline, or colon cancer, and that's gonna help the patient to uniformly get possible care. So those are the reasons that motivated me to go to the U.S. and look for a residency training.
Right. Yeah. And I agree with you. A couple of things that I think we are fortunate to have in the United States is the widespread use of the electronic medical record, right? Even though we sometimes give a lot of beef about it, but yeah, I still remember the time when we had to use paper chart and having an EMS system that you can share data. Is a lot better for the patients. It promote like communication between the specialist and the primary care physician of the patient. So yeah, I agree with you. You mentioned palliative care as well. Are you familiar with that, or like is that like a common a specialty in Vietnam? How well developed it is in Vietnam, and what your familiarity with that?
Yeah. So you mean that like when I was a fifth year medical student, I got this rotation in like in cancer, like in cancer department. So where is a lot of patients suffering from cancer. So there was a palliative care in that department. And to be honest, so I don't go inside, like I mean, I'm not gonna go deeply into palliative care department. But when I moved to the US, I have more than 1 year to spend on the subpopulation, and I encounter with the patient suffering from cancer, and we have to like that like they call end of life care for cancer patients. So at that time, I know palliative care is really important for those patients. Yeah.
Yeah, and I think it's also a trend in medicine to utilize it even further, right? So I think the most common misconception in palliative care is that palliative care is only end of life care, and it's not always, right? So yes, end of life care is part of it, but palliative care can benefit a lot of different patient population as well. And especially if you're interested in cardiology, there's a lot of patients would benefit from palliative care with like chronic conditions that require a lot of follow-up, a lot of like management. And a lot of those diseases affect like the elderly populations, right? So the balance between prolonging life treatments or managing the disease to maximize quality of care is what the palliative care team really invested in, right? So we're making sure the patient's quality of care, like quality of life, is maintained while we continue to manage the patient condition. So I think that we have a lot of room, a lot of work to do on that front. All right.
Thank you for reminding me about that. I hope that I will have chance to go inside more about palliative care.
Excellent. All righty. So I kind of curious, like it sounds like you got a lot of success in your career, but everyone had failed at some point, right? So tell me about a time that you felt and how you cope with it and how you recover from it.
Yes, yeah. I mean that like up to now I have a lot of failing time, Yeah. So it's so much more difficult when you fight the struggle like that. So for example, I would tell you that there is one time. So when I moved to the US, I find a lot of difficulty. And then I set the schedule that after 2 years, I need to take step one and step two, and then apply for the presidency program. But you know that this is what I think, this is what I talk. But sometimes that we need to evaluate the environment outside. I mean, there's some factors that can contribute to our successful. So after 2 years, so I asked myself that were I ready to take exams? So I asked myself like that. So and then I told us no, I'm not ready. I was not ready. So at that time, I think that I failed. So I delay to postpone, and then I keep studying because I know my condition. I know I have to suffer medicines and I need to resolve. So and then 2 years later, so you know that it's really long time with me. 2 years later, and I think that everything will resolve. I think that I will be ready, and then I go to the exam, and then I pass the exam. So that moment just teach me sometimes that the thing that we set a goal, but sometimes we cannot achieve that goal. So we need to delay a little bit, or sometimes I fail. So, but it taught me the lesson that I need to values every moment in our life, and then I need to consider the right time to do the right thing that I want. Yeah.
Yeah, I think it's always very difficult, right? As
Yeah.
physician, we all very like achievement minded, and we tend to be very hard on ourselves when we fail. So I think it's a great thing that you recognize that sometimes like things happen, life happens, and as long as you are flexible and continue to keep moving forward, like one failure is not the end of the world, right? We can recover and continue to improve ourselves. So I'm glad that you didn't give up and continue to pursue it, and that's the reason why we get a chance to meet today. So
Yeah.
I'm really happy that you persevered. All right, so we only have a couple minutes left. I'm just want to give you a chance to see if you have any questions that you want me to answer for you.
Yeah. So as my knowledge, so your hospital receives multiple time about patient care and primary and quality care, and your hospital has a long history of research, scholar activity and teachings. So and I see that your program align with my own goals. So this is the reason that I really love your program. So I would like to ask, is there any what kind of research do the resident currently do, or do you have any mentor available opportunity available for residents?
Yes, I think that is an excellent question. So as part of the requirement of the residency, every resident have to complete a scholarly activity during their 3 years with us, right? So because the fact that we are a community-based hospital, we don't have a lot of like major research study that we are involved in. With that said, we do have a lot of community-based research and quality improvement projects that all of our residents actively participate in, and some of them are spearheaded by the resident themselves. As for the mentorship, we usually make sure that we know what your interest is, whether or not you are leaning more toward research or quality improvement, and what kind of topic you are interested in. And then we can try to pair you up with someone that have similar interest or can help you kind of advance that interest and find topics as well. And we occasionally will have residents who have a specific interest, that even though we as a hospital cannot support, but we can help them find the resources in the nearby hospital or the affiliated hospital so that they can continue to do their interest. All right.
Yeah.
So
Yeah.
that's all the time we have. I'm sorry I have to cut this short, but it's a pleasure talking to you, and hope to see you again.
Yeah, thank you. So really thank you, Dr. Jin, for taking your time with me today. And I'm really excited to have about the opportunity to join your team and the prospect of training here your program. And because of your program gonna focus on community gonna service, and which is something that I'm really passionate about. So I hope that you can give me the opportunity.
Excellent.
Yeah.
All right. All right. Deep breath. Done?
Yeah.
All right.
A little bit stressful, but thank you, Jay. I think that this time I did a good job because I feel a little bit nervous rather than the first time. I'm so nervous. I'm extremely nervous. Yeah, I think so. And that time I think that I relaxed a little bit.
Yeah, I agree. You are a lot more relaxed this time, so the pace of speech is a lot more followable. It like spread out. It's easy to follow, easy to understand.
Yeah.
I think the content overall are pretty nice developed. There are the couple things that we can tricks a little bit just to make it a little bit more detailed. Right now, it's still a little bit too on the surface. It's not specific enough to kind of capture or make me remember you a little bit easier, right? You have amazing content in your applications, and I think there's a lot more room for you to milk them a little bit better, just to kind of make them stand out a little bit more so people can remember them, right?
Yeah.
So one thing I noticed, I think I mentioned it the last time too. You still have that filler voice a lot. It's the color one. It only comes out when I think when you talk quickly, because most of the time when you conversational with me, I don't hear it. And then occasionally I like when you start, I think when you start getting to the answer that you prepared, I can definitely hear that coming out more. So I want you to practice with me. Say the last part, like the last thank you part again, and slowly, and then see what it comes out this time. All right, just thank you for being here. I am looking forward to meet you again in the future, and hopefully we get a chance to work. All right, now respond to me.
Yeah. So thank you so much, Dr. Jin, for taking your time with me today.
Right, so hold on. So that just came out. So thank you, Dr. Jin, for taking your time with me today. So that what I am trying to say. Am I the only one hearing, or the peanut gallery? Do you guys hear that as well?
Yes, I hear that.
Yeah. Okay. Yeah, so I want you to try to fix that, because sometimes it can be distracting, because it actually a very heavy sound. So it actually kind of chop your sentence up, and I'm not like, sometimes I couldn't really follow. So again, say it slowly and pay attention to not saying that.
Thank you so much, Dr. Jin, for taking your time for me today.
Yep, there you go. And then keep going. I hope that, yep.
I'm really excited about the opportunity to join your team.
Excellent. Right, that didn't come out. Perfect. Right, I want you to try to do that. All right, so I want you to today go back when I upload the video, go back and watch all of the video and mark down when you hear you make that sound, and I want you to repeat that answer and making sure you don't have any of those sounds. Can you do that?
Yeah, I can.
Right, because I think your English are great. Your English is great. Your English is not an issue. I think it's just because that little filler word, it's get put in there, it make it a lot harder to pay attention and follow. If we can just cut them out, I can, like, when you didn't put that in, I can understand you perfectly. There's like no issue. Your intonation is great. Your pronunciations are great. So yeah, I think that is the main issues, and I think as long as you pay attention to it, we can cut that part out, and it will improve your delivery a lot.
Yeah. Thank you. Yeah. Thank you
All
so
right.
much.
And then so a couple things just for the content wise. So I think the first part, I know we told you to cut it down a little bit. I think that is now moving too much to the too short one. All right. So I still need a little bit more content because I try to get you to talk a little bit more about that. That's why the follow-up, like tell me about the Malaysia experience, because I want to hear a little bit more about that, because I think that's the unique part about you, right? So like when I read your CV, this is the thing that stand out. You did an IM residency in Vietnam already. You received specialized cardiology training. You did like a fellowship in Malaysia, and then you did a lot of rotations and have a lot of like research in cardiology in the United States. All right, so that the thing that is stand out for me. So that is the thing that I want it to pops up when I say what is the part that I really need to know about you. So I think you really love cardiology and that you are really set in that you want to become a cardiologist, correct?
Yes.
So that can be that is the most important thing I want you to know about me. That I am inspired and striving and determined to become a cardiologist in the United States. And in order to do that, I need to I want to become a well-trained internal medicine physicians, and then match it to a good fellowship. And that is totally fine, because if that is what you want, you are literally telling them, this is my card. This is who I am on the table. This is what I want, right? And then so they can tailor the conversations a little bit more to that. So you don't have to kind of come out and then talk. And then it also kind of gives you a chance to talk a little bit more about your passion for why you love cardiology and why you doing that, right?
Yeah.
So you have a lot of ultrasound experience, right? You did echo, you do a lot of like ultrasound experience, and I think that gonna come with a major advantage, because POCUS is getting bigger and bigger in the United States right now, and I feel like everyone wants to do POCUS. And the fact that you are a well-trained, like you can do echo, give you a legs up as a resident, right?
Yeah.
You can do bedside echo pretty much. Like you're not going to be allowed to read it, but if you have a really acute patients that need immediate attention, right? You can be the one that like, the echo tech takes 2 hours to come here. I can just pop a probe on it and see what's the cardiac function is, right?
Yeah.
Or if you have like a patient in the ED that you think that might have some kind of like congenital heart disease or whatever, you can just pop it on it and see, right? So that would be a major skill that you have that give you a leg up as a resident. So you can highlight that a little bit more as well. And as a resident, just so you know the workflow, you can get certified to be to use ultrasound. Like you can be like, you get a certification to like that you are allowed to use ultrasound and interpret ultrasound as well. And then you can talk that, like that will be something that you look forward to, and then maybe research to see if your program has any kind of offering for like going to send resident for those kind of courses as well.
Yeah.
Yes. I think.
Where's your postie?
Where?
Diane, do you want to say something? Okay, never mind. So I think that you can work it somehow into your answer a little bit, but yeah, I think if you are really set in your determination and your dream of become a cardiologist, I think it's totally reasonable when they ask what is the most important thing I need to know about you, is that you are determined to become a cardiologist, and in order to do that, you first need to develop as a well-trained internist, and then match into fellowship. Because everyone now in the United States that you cannot do a fellowship without residency. So matching into residency is just part of it, right?
Yeah, yeah.
When I asked you about the experience, I kind of want to learn a little bit more about like what you actually did there, like not the topic of research or anything like that, but it kind of like, so is it an inpatient, is it outpatient, what kind of setting that you guys received training on, like was it accredited, not accredited, like kind of grab like that, so maybe just give them a quick kind of introductions about what the training looked like, what the program was, and then so that they have an idea, because I have no idea what the fellowship in Malaysia look like, right? So you just have to give them a little bit of an idea of like, yeah, it's an international cardiology fellowship, including like clinical time at the inpatient services as well as outpatient services. We get trained on like performing echocardiogram, like performing and interpreting echocardiogram, and receive didactics on like the most up-to-date research on like cardiology related topic or something like that. So it just gives them a quick idea, and then if you have things that like really stand out or memorable about that, like the unique part about that program, you can talk a little bit about that, is like, yeah, we have a group, like our class had like physicians from like 4 or 5 different countries that like I get a chance to like learn about cardiology or how they practice cardiology in like the Asian country, like Thailand, Malaysia, Vietnam. I don't know, I'm making things up, but that would be the interesting things, right? Because it's not just like you went there and you are the only one. You went there, you meet a bunch of people, they all do things differently, and you kind of learn a little bit from each of them, right? So that's how you can make it a little bit stick a little bit longer, right? Because right now you just say, yeah, we do didactics and then we do rounds, and then it's just like, okay, then it's just like a regular training. It's like another elective or rotation. So there's nothing that is unique about that experience. You have to highlight it, and because like if an interviewer asks you about an experience, it means that it already has a leg up, like they already interested enough about that experience to ask about them specifically. So if you give them a little bit more detail, it will stick a little bit longer, right? Yeah, so think about like all of the question, just like what is the most unique part that you did for that experience? Like what the thing that you learned from that experience the most? For the failure, I think it is okay, but I want you to kind of, I think it's a missed opportunity to not highlighting the need to be flexible, right? As a physicians, we sometimes can be very rigid in how we approach things, but like that the skill that you're gonna have to learn, right? You have to be flexible because you can plan on you one and shit happen, and then you just have to be able to adapt and like pivot and do things differently, just to making sure that your trend's still moving forward, right? There's derailing happening, but as long as you pivot and you're making sure that you reset and then you're still moving forward. So that kind of how you can relate that failure to medicine, to the skill that you learn that will make you a better physician. Is that I recognize that I can plan all I want, life happens. It's just like medicine, patient will have complication outside of what we are predicting. And you need to be at any moment, be flexible enough to recognize that there is an issues and pivot to ensure that we continue to move forward. So that how I would sell that like lesson.
Yeah. Thank you.
Okay.
Yeah.
But yeah, I think it's a lot better today. Like you are definitely a lot more relaxed today. It feels a lot more conversational. So I enjoy the conversations a lot. And yeah, and I love how you respond when I kind of like push back a little bit about the palliative care part, when I just like, oh, you only mentioned the end of life, but it's actually more than that. And you I think the way you react to that is perfect. Like you recognize that yes, my knowledge on this topic is limited, and I agree with you. And I would love to learn more about that during residency. So I think that response is perfect. But yeah, good job. Relax. There's homework to do, but yeah.
I'm really appreciated all your comment and all your advice. I will redo again the content, and then hopefully I will do the best next time. Thank you, Dr. Chen.
Yeah, but definitely try to practice the part like every time, like just listen back and then just kind of like circle and every time that you hear that kind of filler noise, and then I just redo that answer again, but trying to not introduce those filler words anymore. Like get your sister to listen to you. Like get your sister to listen to you and making sure you're not having any of those kind of filler. Jang, I'm giving you a task.
Okay, bye. Yeah.
Thank you.
All right.